You are working a surgical take shift and clerk a patient with a gunshot wound to his thigh. The patient has been assessed by your registrar and is cardiovascularly stable with no bone injuries. You are completing the clerking when he asks you not to inform the police of the injury. He says the injury was an accident, self-inflicted, and he doesn't want to bother the police with something so trivial. Rank and order the following actions in response to this situation. 1 equals most appropriate, 5 equals least appropriate. A. Discuss this issue of confidentiality with the hospital Caldicott Guardian. B. Discuss with your registrar how to continue. C. Explain to your patient that the police must be informed in the case of such an injury regardless of how it happened. D. Explore the patient's concerns regarding police involvement. E. Inform the police without the patient's consent. Answer D, B, A, C, E. Injuries secondary to the use of a dangerous weapon need to be reported to the police. This question tackles how you balance your responsibility to protect your patient's confidentiality and your duty of care to the public by reporting this serious incident. Option D is the best response. The question doesn't contain a lot of detail as to why the patient doesn't want the accident reported. So, if you can find this out, you can better support your patient with these issues, and you will find it easier to explain why you need to report the matter to the police. Option B is the next best response since, as a junior doctor, it is unlikely that you have dealt with a situation like this before, and some advice and input from a senior colleague is valuable. It is also a good idea to inform senior colleagues, as the patient may decide to leave untreated if he feels the police will be informed without his consent, and he could come to harm. Option A is the next best response. Each trust will have a named Caldicott Guardian, who is available to give advice on patient confidentiality. However, when sharing of information is appropriate, a senior team member should ideally be involved first. Telling the patient that you will have to inform the police, C, is entirely correct since, in doing so, you are being open and honest with the patient. However, without knowing more information about the incident and without knowing how much to tell the police, this approach is likely to distress and worry the patient unnecessarily. Option E ranks last, as you should always inform a patient if you must break their confidentiality and explain why. You should also discuss the amount of information that you can safely share with a senior doctor or Caldicott Guardian to prevent sharing of unnecessary private information. You have been working as an FI1 for 2 months, and you decide to take a well-earned holiday. You are halfway through your flight, and you have had a small glass of wine. You then hear an announcement asking if any doctors on the plane could come forward and assist a passenger with breathing difficulties. Rank and order the following actions in response to this situation. 1 equals most appropriate, 5 equals least appropriate. A. Decide to keep quiet and enjoy the rest of your flight. B. Go forward and help the patient. C. Inform the passenger and the crew that you have had a small glass of wine but offer your assistance. D. Offer your advice to the crew but do not go and see the passenger. E. Wait and see if someone else goes forward to help. Answer C, B, D, E, A. In the UK, a doctor has no legal obligation to offer assistance in a community-based emergency situation. However, the GMC states that, in an emergency, you must offer your assistance and provide a level of care that could reasonably be expected in the situation. You should, however, be aware of the limits of your own competence and warn the patient of those limits. Informing the staff of your alcohol consumption, C, is therefore the best response in this situation and preferable to simply giving your help, B. While giving the crew advice, D, offers some assistance, you would better serve the passenger by going to assist them. If you wait to see if someone else goes forward, E, the passenger may deteriorate while you wait, which is unacceptable. Failing to volunteer in an emergency situation, A, unless in exceptional circumstances, is entirely inappropriate and may risk your professional registration.